Hi, this is Dr. Toby, your host on Health and Wellness. We're honored, we're privileged to invite you to join us on our show this week with Dr. Danielle Parker. Dr. Danielle Parker is a hospitalist in the city of Jackson, Mississippi, and she trained as a family physician. She came all the way from Chicago, settled into the University of Mississippi Medical Center, did her medical school, went on to do her residency at the Meridian Hospital program under the Rush Hospital Systems. And she's been working now at the Dominican Hospital in Jackson for about 5 to 6 years. You will be privileged to know this young lady of faith. She's a minority. She's a daughter to pastors. She's the third in a family of five. She's a woman of dogged determination who, through all the upheavals, kept on going. You don't want to miss what she has to say. She'll inspire you, she will encourage you, and she'll bless your life. God bless you. In Jesus' name. Hi, this is Dr. Toby, your host on Health and Wellness. Thank you so much for joining us. We've been talking with Danielle Parker. Danielle Parker is a family physician who is currently working as a hospitalist in the Jackson area. She trained at the University of Mississippi Medical Center, one of the few African-American females successfully graduated, went into residency in Meridian, Mississippi, and came out on top. I think she served as chief resident and became one of the leaders in family medicine as a result. I think you also worked as the board member in your final year
I did.
in the Mississippi Academy of Family Physicians, so she
did.
had some leadership roles. And, we just want to hear a good old story about how God kept you, gave you triumph, gave you victory in the midst of all the battles of life. Nobody takes these battles for granted. But the reason we're here today is to educate this viewership on what a hospital is. So you studied family medicine. You spent 6 years in total, 7 really, medical school, then family medicine, 7 total. Undergrad was 3 years?
Yeah. 4.
4 years. So here you are, you did 11 years, and then you did 1 year of a master's?
I did 1 year of a master's,
Okay.
and then in between that, I worked.
Right.
And
So
I,
this is what my viewers are asking. You spent 12 years work training to become a physician. Is it worth it? The reason why they're saying this is because as a female, people think of you as what they call a reproductive time clock and all
yeah.
those
Well,
details. You know what I mean?
right. I do.
And some of my
I do.
viewers said, if I do that, I might not have time to raise a family, go around what I want to do. So the question is, has this 12 years of training been worth it? Financially, socially, spiritually, economically, materially, matrimonially? What do you think?
Well, I mean, where I'm at right now, I would say yes to most of those things. I think it has been worth it because, like I said, I feel like this is my purpose. So I do feel like the years have been worth it in that I've gotten to, fulfill the purpose I feel like God has for me. That's part of it. In that I feel fulfilled because I feel like within that process, God has kind of grown me up. You know what I mean? Like I've had I have a deeper relationship with Him. I feel like I've gone through things with God that have showed me things and given me more revelation. So I think I do feel purpose in that experience. So I will speak to that. As far as financially, I mean, now it's better. Now that I've gotten to a certain point where I'm actually making money, it's better. And not to say that it wasn't a bit of a struggle, in the midst of that. But now it's better. But what I say in totality, is it worth it? Yes. Now I do feel that there are some mistakes that I feel like others make sometimes, and I think that I have made in that they don't live their life in the midst of it. And I think that's something that I would really recommend. I think there were times in my career that I just focused on my career, and I think that even made it hard for me in my career, if that makes sense. So I think you kind of have to put things where they belong, and I think you have to kind of have a whole life. And so what I mean by that is if you have a hobby that you had before medical school, make time for that hobby. If if you think God is drawing you towards this person, make a little time for that person. I think that is important because I feel like if you have things like that in your life, it'll be easier for you to focus on medicine and pursuing your dreams in that way. Whereas when you don't have anything else, sometimes when medicine gets hard, and if that's your only thing, it
Mm-hmm.
can lead to you doubting yourself, you having a hard time, you not wanting to focus as much as you should. So
Burnout.
yeah, it
Yeah.
lead to burnout. Exactly.
Mm-hmm.
So I do think that that is important for
Mm-hmm.
anyone. So I think anything is possible. So in my journey, I think it has been worth it. But have I gotten all of those things? No, there are things
Still,
that I still
so
don't
tell
have.
us about the loans. A lot of them are concerned about the student loans after you
Hmm.
go through medical school and
Um,
undergrad and postgrad. And do you still have I mean,
I still have a
financially?
lot of loans. I
Okay.
do. I still have a lot of loans. A lot of my loans actually come. So medical school wasn't as expensive as I thought it was going to be. I think at UMMC is probably one of the least expensive in the country to go to. My loans probably came from my master's and my undergrad. Actually had quite a lot of loans. So if I were to do it again, I would probably work towards not having as many loans in undergrad.
Mm,
And then if I have to get loans for medical school, fine. But I think the loans in my undergrad, I probably could have avoided some of those had I known better. Right. And a lot of times we don't know better.
did you ever think of the Mississippi Rural Physician thing?
When
Scholar.
I did for a second, and the only reason why I didn't go that route is because I wasn't sure how long I was going to be in Mississippi. Like when I wasn't sure if I was going to stay here, which I wish I had done it because I stayed here. I ended up staying here. But when they first offered it, I was like, oh, am I going to be here for long?
Well,
I
you
don't know.
wouldn't have been able to work in Jackson.
Hmm?
You wouldn't have been able to work in Jackson.
Right, right,
You'll have had to
exactly.
go outside
Right.
Jackson. So
But I mean, I think where you go to residency counts, correct? Oh, it doesn't.
it's
Okay, well
after
maybe not. I thought it
residency.
was. I thought where
After
you go to residency.
residency.
Okay, well then maybe not.
So
Maybe it
the
wouldn't.
Mississippi Physician Rural Scholar means if you finish residency, you have to work in a what they call a HPA. I think they call it the hospital underserved
Yeah, I forget
shortage
exactly what
area,
it is. Yeah.
hospital physician shortage area, something like that. So basically, you go there and you work for 3 years.
Okay.
Yeah.
Okay. I'm
So.
sorry. Yeah, I was under the
Mhm.
impression that
So
that
like
was the count.
McGee,
Hmm.
Cleveland, Clarksdale,
Some of
somewhere
those areas that
outside
don't have.
Jackson.
Okay.
Hmm.
Got it.
But
Got
the
it. I have a lot of
benefit,
friends that did that,
yeah, the benefit is that they pay 40,000 a year
which is
for your
nice.
university
Exactly.
education. So
Mm.
there's alternatives. You can get student loans, you can get scholarships,
Hmm.
but the goal is pursue your dream. Don't just
Exactly.
let your dream die on the
Exactly.
table.
Because I mean,
Okay.
although I do have loans, I am handling that. Like it's not
Hmm.
hard for me to handle my
To
loans
handle
now
that.
that I'm at where I'm at. And I also always use this example. There was a medical student. He was a medical student when I was in undergrad, who paid off all of his undergrad loans and did not have any loans for medical school because he wrote essays for all these small loans you could find on the internet. So I think it's one thing people don't really take
Really?
into account is that there are so many scholarships that you can find just by Googling that people don't know about. And because people don't know about them,
Hmm.
maybe 10, 20, 30, 40, 50 people go out for them.
Wow.
And then you're more likely to get it. And it's a smaller scholarship though. But if you do five or six,
It
that
makes a
money adds up.
difference.
So he
Yeah.
was able to pay for his books. He was able to do all of that. He was like, I'm going to do this without loans, and he did it without loans.
Wow.
Hmm.
So tell us why family medicine? So you could have done surgery, anesthesia, OBGYN. Tell us why family medicine after your medical school.
So the thing that I think that I love about family medicine is that it's so broad, right? There are so many things that you become efficient in when it comes to family medicine. So I take my residency for example. We did a lot of hospital medicine, had our own
Service.
service. So I learned a lot in hospital medicine with that. We had our own clinic and a free clinic. So I was in our clinic and a free clinic.
Oh.
We did door to door family medicine. So I got to knock on people's doors, do family medicine. We did a lot of our own little procedures in our clinic, right? Whether it be suturing, removing moles, tending to wounds. We would go into nursing homes and we had our own nursing home patients. I just felt like I was getting a lot of education on the totality of medicine.
Mm-hmm.
And then I also love the fact that I was kind of at the front lines, right? So, I'm the one that gets to see that patient that hasn't been to the doctor in a long time, or that patient that has had this one problem for a long time, and I'm the one that gets to say, okay, this is where we need to go, this is what we need to do, and I kind of get to meet them where they are, and I think that that's important. I think
Mm-hmm.
a lot of times physicians don't get to do that outside of family medicine, and so that's why I love it, because I feel like I'm at the front lines, and I feel like I have a lot of education on a broad
Mm-hmm.
number of things.
And you were one of the first sets in Meridian, right? Were you?
I was.
Like the very
We
first?
No, I
Or?
wasn't the very first.
Okay.
I want to say we were maybe the third or fourth
Okay. Okay.
class.
It's pretty awesome. Yeah.
Yeah,
And
in St.
obviously
Augustine.
that's like 2 hours to Georgia,
Hmm.
2 hours to Jackson, so you could go see your sister, go home.
Right. Exactly. Exactly. So I was always kind of, if I wasn't working, I was definitely either coming to Jackson or going to Atlanta.
Atlanta,
Yeah.
right?
Hmm.
Interesting. Your dad doesn't have family in Georgia still, does
Oh
he?
no, he does.
Oh wow,
So all of my aunts and uncles on my dad's side
I still
are
there.
still in, except
Oh
for
wow,
one, I think, are still in Georgia. So I still have lots of cousins
wow,
and stuff
wow.
in Georgia on my dad's side. That's where they're from.
And your mom's family is mostly in
Mostly in
Vicksburg.
Illinois.
Oh, in Illinois
Yeah.
now.
So I
Wow.
have so my like for example, my grandparents. I'm sorry, excuse me. My grandparents on my mother's side are from Vicksburg, and so like my grandfather's sister is still there, and her kids are still there, and her grandkids are still there. So I have like extended family in Vicksburg, but my actual aunts, uncles, cousins on my mom's side are in Illinois because they all moved to Illinois,
So
at one point.
you were you the first physician in the family genealogy?
I was, as far as I know.
Okay,
Hmm.
okay.
Hmm.
So did they all call you for your opinion on medical things,
Yes.
COVID and
Yes, yes.
cancer and diabetes
Yes, I'm definitely the one, the go-to call
and that's
when
why
everything's
family
going on
medicine
in
is
family.
good. You know a little bit about everything,
Exactly. If I
enough to not be dangerous.
exactly, and enough to at least point them in the right direction. Like, hey, this is what we need to start with. This is what we need to talk to. Yeah. So.
Wow.
Mhm.
A lot of things, a lot of people don't have that point person in the family, so
Yeah.
they end up going on the internet and getting wrong information and
Yeah.
hurting themselves as a result. So every
Hmm.
family should have a medical person,
Yeah, I agree.
a nurse,
Hmm.
somebody who can give them information just to make the naysayers not get into the family and give them the wrong opinion.
Yeah.
Yeah.
No, I agree completely.
Yeah. So tell us why hospital medicine? You finished family medicine, you were the chief resident, you could have opened a clinic right across from the hospital, but you want to do hospital medicine. No. So first of all, let's say what is a hospital medicine under the banner of family medicine?
So, what hospitalists do daily basically is we're the general doctors to take care of you when you're admitted to the hospital, right? So, we will admit people to the hospital from the ER. So what we usually do is we'll have a patient that we've admitted, and we'll follow them for most of their journey in the hospital. We're the ones who, kind of like I said before, being the front lines. We're the ones who will take a history and physical, decide this is where we need to go, this is what the treatment plan is. Maybe we need to get pulmonology involved, maybe we need to get cardiology involved, and we're the ones that usually make sure that the whole treatment plan stays coherent throughout their journey, and then also comes up with like the discharge plan and beyond. So that's what hospitalists do. And so for me, being a family medicine hospitalist, it kind of, to me, it really doesn't, it isn't far fetched because, again, you're still at the front lines, right? I'm the one that's actually doing the complete history and physical, finding out exactly where this patient is coming from, exactly what their immediate problems are, how we need to address those immediate problems, and then at the tail end, how do we get here and how do we keep this from happening again, right? So, let's say I have a patient that comes in with congestive heart failure, whether it's new or chronic, right? It's a question that we have. We take care of their immediate acute congestive heart failure problems, and then I'm like, okay, do we need home health? Do we need to make sure we have these medications on board? Do we make sure that we follow up with cardiology or that cardiology is on while we're here? Making sure that we don't come in next week with the same problem, and that we're set up, to see
Right.
somebody outside. So that's how I see.
It's a
Um,
new field. It's not
yeah.
been maybe 10 years old?
Yeah, it's a
Okay.
pretty new field. Yeah. So.
So in the past, people used to work in the clinics, then go to the hospital, see their patients, then come
Mhm.
back to clinic. That's what we call the traditional family physician.
Exactly. And I actually thought about that before I decided just to do hospitalist work.
Okay.
Hmm.
So most hospitals in 2022, the doctor you see in the hospital is probably a hospitalist.
Hmm. Hmm.
So he discharges you to follow up with your primary care physician.
Exactly.
So you're like the in the hospital provider of care
Exactly.
more than anything else. Wow.
Exactly. I remember actually as a student at UMMC, I followed Dr. Cisse, and he would do at the time he had his outpatient clinic, and then he would also had patients in the hospital that he would
Also,
go and see and round on.
in Raymond, right?
And exactly,
Yeah.
and that was one of the reasons why I considered doing that, but then decided to just go ahead and just do
Just
the
one,
the
right?
hospitalist. Hmm.
Yeah. So, is there any particular training to be a hospitalist? I know there's some fellowships that encourage you to do a 1 or 2 year hospital medicine procedure track. So, what were, I mean, tell us about that since you're versed in that field.
So there is training, and then there are also like hospital medicine groups, right? There's a 1 year training for family medicine doctors that you can do to just focus on hospital medicine, just much like there's a 1 year training for ER. You know, depending if you want to specialize.
Hmm.
Um, One of my mentors actually in residency, Dr. Johnson, he was a hospitalist where I was in Meridian. And I talked to him about, doing a 1 year, and I actually considered doing it. But the reason why I went ahead and went on into hospitalist medicine without doing the fellowship was because I felt like I got a lot
Of
of hospital
hospital.
medicine
Mm.
because we were the only residents in that
In that
hospital.
hospital,
We got a lot of hospital medicine, and so I felt like I got enough to actually go into the
right?
field.
Right.
But if you like, so, let's say you're in a family medicine residency, then you don't get a whole lot. That is a an option for you, and it's a
Hmm.
pretty good option. It's a
Hmm.
year, of just concentrated hospital medicine, which I think is important.
So most hospitalists in 2022 are internists.
Mm-hmm.
So family medicine makes up a little, some of the
But small,
percentage.
right?
Okay,
Exactly. Hmm.
okay. So technically, the internal medicine folks do not do the hospital medicine fellowship, or they
Most
can
don't.
if they want to,
Most
but
don't.
most don't. It's mostly
Yeah,
a family
it's
medicine
mostly a
thing.
family medicine thing. If you
Okay.
feel like you didn't, like you feel like your family medicine residency really just
Hmm.
focused on clinical, it's outpatient medicine.
Oh wow,
Yeah.
interesting. Yeah. What's the hierarchy? Because if I'm a family medicine physician,
Hmm.
I probably report to my chair, my office medical director. Who supervises a hospitalist?
So in my it all depends. There are some hospitalists that are actually their own entity, right? Like they actually contract themselves out to different hospitals. I work with a hospitalist group within my hospital. So in my hospitalist group, we have like a chair that we report to, and
Hmm.
who keeps track of how we're doing as a group, our numbers, any individual issues we might have. So we report to that person as a whole, and then the group is made up of internists and family
Family
medicine.
physicians. Right.
And so we all kind of come together and report to that one person.
Okay.
Yeah.
I know
Um,
there's the American Society of Hospital Medicine.
yeah. Hmm.
Okay.
Hmm.
So does that officially make you a member? Is that
No,
recommended?
you can be if you want to
Okay.
be.
It's
I
not.
mean,
It's not
I'm a member of family medicine physicians,
AFP.
right? Right,
Okay.
exactly. But you can be if you want to be. And then they also have their own fellowships that they offer as well,
Oh. Okay.
that are offered for internists and for family medicine.
Oh. Right. Just because, yeah, hospital medicine, you're probably going to do a few more procedures, maybe
If you
intubations if you want
if
to,
you want to,
central
right?
line,
So
A lines, and
it all depends on what you're comfortable
what
with,
you're
which
comfortable
which
with.
I like that option, right? So if
Hmm.
I for example, where I'm at, we don't have to run codes. So, if a code is called, the ER doctor is immediately going to come up to run the
Hmm.
code. If I'm there, I'll start it. You know what I mean? But it's
Hmm.
not something that I have to do.
You're
I don't have to do
obligated to
those
do.
things. Right,
Wow.
exactly. So it all depends. I'm sure if I went to a more rural hospital, I might be required to do more
So
things.
20 years
Yeah.
from now, do you still see yourself doing hospital medicine? You told me a few weeks, months, days, minutes ago that you were thinking of palliative as an end of
Yeah,
your
I do.
practice thought.
I do think I'll probably end up doing some palliative care. Now, whether hospitalist medicine is a smaller part of that or
Hmm.
not at all there, I'm not sure. I haven't decided if I just want to be done with it or if I just want it to be a smaller part of my career.
Right.
But I don't. I don't think it'll be. I don't think I'll be doing hospitalist medicine like just 100% like I'm doing it right now. I do think will probably look a little different
And hospice
as I go
entails, probably seeing patients in the clinic,
on. Mm-hmm.
and then I guess making hospital visits as
Exactly.
needed.
Exactly.
So right now your hours are 7 to 7,
Mm-hmm.
7 a.m. to 7 p.m.,
Right.
7 days a week.
Mm-hmm.
Okay.
If I get everything done in that time, yes.
Okay. Okay.
Yes.
Average number of patients is 20, 25.
Yeah. So I think we actually average. It depends on who you work with. So I've had times when I've worked with like an NP with me,
Hmm.
so we have more patients. So it'll look more like 25, 27. Lately, I think I've been seeing at the most 22 on my own. That's usually what I've been
Okay.
doing. Yeah.
Interesting. Because a
Mm-hmm.
lot of my viewers are like, oh, wow, well,
Mm-hmm.
that's pretty good. I mean, income is steady.
Mm-hmm.
You take a week off. That sounds remarkable.
Yeah, and which I did like the schedule. It's one of the reasons why I was drawn to this. However, you do work
On the
very
one
hard
week
on
off.
that week that
Oh,
you're
the one.
working.
Okay.
Yeah, no, I mean you're working on that week that you're working.
Because I
So
know some hospitalists who have
mhm,
traveled the world. Every
mhm.
time they're off,
They're gone.
they're gone to another
Yeah.
part of the world.
And I mean to me that's great. That's
So what do
ideal.
you do when you're off?
So well lately I hang with my family a lot. So one thing that I do when I'm off, I'm with my nephew, I'm with my sister, I'm with my mother. I take care of my aunt sometimes. So I feel like I'm with family. Every once in a while I might travel from here to there. I have some plans to do a little more traveling than what I've been doing lately. And that's about it. I probably go to church a little bit more because I'm not able to do that on my days on.
When you're there, all right.
But yeah, that's about it. I don't do a whole lot other than rest a little bit.
You don't take another job working in urgent
I
care.
don't, and some do.
Some
Now,
I
some people
heard.
do that. I mean, I've definitely had colleagues that have been busy in there, but I don't. That was the whole point for me. Like I wanted my time off, so I don't work more than my first job.
Wow, wow. So, like I said, 20 years from now, what do you see
Mhm.
yourself down the road?
So, ideally, 20 years from now, like I said, I'm interested in hospice work. So I do see my job, my career going that route. I would love to be able to teach somewhere. I love to be part of like an academic community in some way. Let's see what else. Like I said, being a hospitalist, maybe I would do that to a certain
Hmm.
extent, but not as much as I do now. Like probably be more on my own terms. Like I would
Is it
pick up shifts
difficult to
here or there.
do hospitalist for 30 years? Is it hot? Is it difficult? And why is it difficult?
I will say this. I would say that the answer to me is probably yes. Right. I think it would be kind of difficult to keep that type of schedule going for years, for 30 years. But I think that outpatient clinical medicine has its own its
Precious.
own pressures that I think would also make it a little trying to continue to do that for years as well.
Hmm.
So, I mean, I think that it is important to kind of figure out where you want to be like you said, in 20 years and 10 years and 5 years and what that looks like. Yeah.
So you mentioned Dr. Johnston. He
Hmm.
helped mentor as a resident. Anybody in the hospitalist field that has been a mentor that you can recognize or
I would say who I work with now, Dr. Dias, who's the head of my hospitalist group here or in Jackson. I think she's been a great mentor to me as somebody that I can look at her career as something to aspire to. And
she's an
or to,
internist,
yeah,
right?
she's an internist. She's an
Okay.
internist. It's been a couple of Dr. Dudley is somebody who used to work as a hospitalist, and now she has her own outpatient
Oh,
clinic. She's a family medicine doctor who did it, and somebody that I admire their career.
so that's an option. You
Mm.
can transition to your own
Yeah, and that's what she did. I
family
mean,
medicine.
hmm
Does she have a concierge or is it regular
It's
clinic.
regular
Oh,
clinic,
okay,
and
okay.
she what she did is she built up her clientele
Oh, okay.
until she her clinic
She
was able
had
to support, right,
right.
and then she left the
Most people
hospitals.
do it for I think the hours. So if you
Hmm.
have 7 to 7 and you have little kids, it's hard to grow up with them
Yeah.
because you leave, then they're going. When you
Hmm.
come back, they're in bed.
Right, right, I can
So at
imagine
times
so.
I think the dynamics of family
Hmm.
training your kids makes a difference.
Which is why part of the reason why I don't see myself doing it forever. You know what I mean? I do think I probably will have to will have to adjust my schedule
Wow.
at one point, at some point or another.
Wow. Well, we've been talking with Dr. Danielle Parker, one of our favorite physicians, family physician, and hospitalist in the Jackson area. One of the very few African American female hospitalists. I mean, it's a it's a job that takes your time and it encroaches on your home family time. So when you see someone giving this kind of quality of service, it's somebody that you want to commend and learn from. So I'm sure you've learned from her, and I'm sure you've got some takeaways from her discussion. When we come back next, we're going to talk about the final session of the program, family, faith, and fortune, how she combines all three and how she has successfully wielded that over the last 30, 37 years, I believe. So join us. Don't forget, Holy Ghost Night, December 30th, last Friday of the month of December. We're going to have a last Holy Ghost Night in the year at the Oyo Hotel on 165 North. It's going to be explosive. It's going to be a time of prophecy. We're going to be seeing what God has for the coming year. We're expecting a divine visitation. Don't miss it if you're in the Jackson area. We're looking forward to seeing you there. The time is 11 p.m. to 4 a.m. I'll be ministering. My wife will be with us, and then friends and other supporters of the ministry will be there. But we're expecting God to show us the plan for the new year. And if you've seen the recent highlights of my new book, Assertive Initiative, The Light That Darkness Cannot Comprehend, you should get a copy. It's on Amazon. I believe it's about $15. But this book is what I think will move your life to the place God wants it to be. That darkness that has kept you in the shadows, it's time to get that darkness out. And the only way you can do that is by shining the light. But the light doesn't just shine, it has to be assertive, it has to be directed, it has to be focused, it has to be in line with the will of God. Many of us want to get out of the darkness, but the light is scattered. The light is not in a direction that can make a difference. This book gives you insight on how to walk in the light so that you too can be a light to your generation. It's been a pleasure talking with you. I'm Toby Moma saying Jesus is Lord. See you next week. God bless you.